Welcome back to our channel, where we dive deep into health insights that truly matter as we age. So if you're here looking to make more informed decisions and take control of your well-being, you're in the right place. Today, we're about to explore something both eye-opening and potentially life-changing: 7 common medical checkups that, believe it or not, may no longer serve you, and could actually cause more harm than good as you enter a wiser, more seasoned stage of life. It's a topic that doesn't get nearly enough attention because we often grow up believing that more tests and screenings automatically equal better health outcomes. But in reality, as the years go by, the benefit-risk balance of certain procedures shifts in surprising ways. So whether you're in your 60s, 70s, 80s, or even just planning ahead for the next chapter, it's time to look closely and critically at these tests that might be doing more than their fair share of harm. Let's start by acknowledging an important truth: medical science evolves, and the best practices that guided your healthcare in your 30s and 40s may not be the same ones that should guide it now. The goal isn't to throw out preventive care entirely, far from it, but to replace routine habits with smarter strategies that reflect your current health, lifestyle, and personal goals. For instance, take the annual full-body scan, a procedure often sold as a catch-all, early detection miracle for people hoping to avoid cancer. While it may sound like a proactive step, it often finds benign anomalies that lead to further tests, biopsies, anxiety, and sometimes unnecessary surgeries that come with their own risks, especially in older adults. The more we scan, the more we find, and often, what we find has no clinical relevance but still sets off a cascade of follow-ups that can compromise your quality of life. Another example is the routine colonoscopy. Once you reach a certain age, say 75 or 80, and especially if you've had previous negative results, the potential benefit of repeating this invasive screening drops significantly, while the risks, such as bowel perforation, complications from sedation, or post-procedure bleeding, become more prominent. It's not about ignoring colon health, but about understanding that, past a certain point, the test may no longer be worth the toll it takes. And then there's prostate-specific antigen, PSA, testing for prostate cancer in men. While detecting cancer early sounds like a clear win, PSA tests are notorious for false positives and overdiagnosis, meaning they find cancers that are so slow-growing that they'd never cause symptoms in your lifetime. But the fallout from a positive test often includes biopsies and treatments like radiation or surgery, which can lead to lifelong incontinence or erectile dysfunction, dramatically impacting your well-being for what might be very little benefit. Similarly, mammograms in older women, especially those over 75, should be reconsidered. If you're in generally good health, a discussion with your doctor might still justify them. But if you have other serious health conditions or a limited life expectancy, the stress, radiation exposure, and potential overtreatment resulting from false positives could outweigh any possible gains. Breast cancers found at this stage are often slow-growing, and the emotional and physical burden of surgery or chemotherapy might not align with your personal goals for quality of life. Then we have the routine bone density test, or DEXA scan. While osteoporosis is a legitimate concern, especially for postmenopausal women, the truth is that these tests rarely change treatment plans in very elderly patients, and they sometimes lead to prescriptions for medications that come with serious side effects like gastrointestinal issues, atypical fractures, or even jaw necrosis. At a certain age, focusing on balance, strength training, and nutrition may serve you better than another scan and another pill. Another one to question is the annual electrocardiogram, EKG, or stress test in the absence of symptoms. For people who feel fine and have no history of heart disease, these tests often turn up non-specific results that prompt even more tests, some of which are invasive or carry risks like contrast dye exposure or complications from catheterizations. It's a slippery slope from a benign result to a full-blown medical ordeal, and in someone without symptoms, the payoff is extremely limited. And let's not forget cervical cancer screenings, like the Pap smear, which most guidelines agree can stop at age 65 if you've had a history of normal results. Continuing to screen beyond that can be uncomfortable, unnecessary, and lead to treatments for conditions that are unlikely to ever impact your health. The key theme here isn't to encourage neglect, but to inspire thoughtful, personalized care. As you grow older, your health goals naturally shift. Instead of chasing every potential problem, many older adults choose to focus on maintaining function, avoiding harm, reducing medication side effects, and enjoying life on their terms. This means shifting from a mindset of just in case testing to one that prioritizes evidence, comfort, and clarity. Each of these screenings, at one time or another, may have played a useful role in your healthcare journey. But what served you well at 45 might no longer align with your goals at 75 or 85. And that's not a failure of medicine or of you. It's simply a reflection of wisdom gained and perspective earned. It's about aging with intention, not fear. The reality is, the older you get, the more likely you are to suffer harm from overtesting and overtreatment, things like surgical complications, medication side effects, or even just the psychological burden of being labeled sick when you're actually feeling fine. More tests don't necessarily mean more protection. Sometimes they mean more worry, more appointments, more pills, and less peace of mind. The question to ask is no longer, can we test for this? But, will this test improve my life in a meaningful way? That's a shift from quantity to quality, a principle that matters in medicine as much as it does in life. So what should you do instead? Start by having open, honest conversations with your healthcare provider about what tests are still serving your health and which ones are no longer worth the trade-off. Ask not just about the risks of a disease, but about the risks of the tests and treatments themselves. Discuss what matters most to you. Is it independence? Is it staying out of the hospital? Is it minimizing discomfort? Whatever your goals are, they should guide your care, not a one-size-fits-all checklist designed for a different stage of life. You could also consider working with a geriatrician or a doctor experienced in treating older adults, who may have a more nuanced understanding of how preventive care should evolve. And don't forget the role of self-care. Lifestyle choices like movement, social connection, a good diet, stress management, and adequate sleep often yield far more consistent, proven benefits than any screening could. These are the true cornerstones of health at any age, and especially in later life. Finally, we want to say that choosing not to undergo a certain test doesn't mean giving up. It means choosing wisely. It means acknowledging that more is not always better, and that sometimes doing less actually protects your health more. This approach is supported by growing medical consensus and endorsed by major professional groups who now recommend stopping certain screenings after specific ages or conditions. You deserve care that honors your experience, your goals, and your right to live well, not just longer. So thank you for being here and for investing in your health in a smarter, more empowered way. If this video has helped you rethink your approach to checkups, please consider subscribing for more content like this and share it with someone who might also benefit from a gentler, more personalized path to wellness. Remember, wisdom isn't just about knowing more. It's about knowing what matters most. We'll see you next time.